Hey guys, what's up? So I saw I'd make a second video on our road to medical school journey. So a lot of stuff happened. So classes finally started again. So currently second year in a community college. So kind of really starting from the very bottom. Found a really neat website called Notion that lets you kind of organize everything really easy. So I have my class schedules all set up like this. Got some Zoom classes, in-person classes. Not going to take my bio classes just yet. We gotta finish out our general ed classes. And then we got some MCAT resources that I'm gonna kind of just grind out eventually. And gonna go through biology as well. And of course use a resource known as Anki, which is which is sort of a like a Quizlet of sorts, but it's more based on uh, more like active recall. So it's kind of like Quizlet. A Quizlet lets you, make your own quizzes and a bunch of other stuff. So this is a really neat website. So I kind of want to just go over and talk about human anatomy because it's kind of like a huge basis for everything to do with medical. We have, of course, start off with anatomy and physiology. Anatomy is like more physical structure of the body and its systems. Well, physiology is more about the functions and activities of those biological components. So, and then usually when you see like a person, you have them split up in planes, like the planes of the body, or something like this. So you got like a coronal plane, transverse plane, sagittal plane. Something you got something called a mid-sagittal plane. So coronal is more about like the front and back. Transverse plane is like the top and the bottom. Sagittal plane is the left to the right, and mid sagittal is like considered like the midline, left and right, equal halves. So kind of goes through everything from the skeletal system and all the systems combined. So this could be a bit of a longer video. So skeletal system, right? It protects our body and provides many functions such as supports our body, establishes a framework to attach soft tissues, and your protects your internal organs, such as your heart and lungs and your brain, for example. Like those are the first ones that come to mind. So your skeletal system consists of bones, and there's two big groups of bones: the axial skeleton and the appendicular skeleton. So the axial skeleton consists mostly of the longitude part of the body, from like the skull to the tailbone. The axial skeleton is like pretty much just everything else, really. And it's just not just the bones itself. It's, you got ligaments, tendons, and cartilage. Ligaments, like the type of structure that connects your bone to your bone. Tendon, muscles to bone. Cartilage, cushion between bones. The little squishy part. Great way I remember it is that tendon, because like 10 out of 10. Like you usually your muscle to the bone, and usually you think about your muscles, you'd be like, wow, that guy's a 10 out of 10. So I think of that as tendon, right? And then you gotta learn about your sockets, your ball and socket joints. That's like your elbow, might be not your elbow, your shoulder. And then your hinge joints would be like your knee or like your elbow. And then next we got your muscular system, which is heavily connected to the your skeletal system, because you got skeletal muscles, voluntary muscles, and involuntary muscles, which are usually found like in your heart muscles, like your cardiac muscles. Because if those weren't voluntary, then you probably die, because those things have to be active at all times, even when you're tired. Weird part about muscles that they actually get tired over time, but it can't happen the same way for your cardiac muscles, because what if your cardiac muscles get tired, then your heart starts beating, right? So it's kind of like that. It's a lot of really names for muscles. Like you got your deltoid muscles, your bicep muscles, triceps, your glutes, your quadriceps, your anterior tibial, your gastrocnemius, rectus abdominis, all of those. Then we got the pulmonary system, or your not pulmonary system, your respiratory system. You got it starts from the mouseway, also known as the upper airway. You got your lower airway. So it kind of just respiratory system is extremely important. Your body can only go like a couple minutes without any oxygen whatsoever. Like this part right here, we know as the upper airway. This would be the lower down airway, and then we got your pharynx. It's usually divided into multiple parts. Got your oral pharynx in the mouth. Got the nasal pharynx, and then you got the larynx. The larynx itself is sometimes called the voice box, or and then you got the laryngeal pharynx. So, and then you got the little bronchi over here, or not bronchi, or trachea, right? Trachea and esophagus are kind of the same area, so you have a little flap up here called like the epiglottis that prevents food from entering the wrong tube. So a lot of times when you're like coughing like crazy, it's because you're accidentally swallow food into the wrong pipe. Then you got over here your bronchus, and your right and left lungs, and they both have different lobes. Like your right lung, for example, has 3 lobes, your left lung has 2 lobes, and you go really deep into where your bronchus is. You can see bronchioles, and then they have these little things called alveoli, which have these little vessels in them called capillaries, which is also connect to the circulatory system, right? Your blood. Down here we got the diaphragm. It's connected to your breathing, right? It's the primary muscle used for breathing. It'll expand and when you're breathing. Then so right, what else? Then you got the your breathing rate, right? So your normal breathing will be known as the tidal volume. So that's around like 500 milliliters for an adult. And then we got the inspiratory reserve volume, which is the deepest breath you can take. So we like that. That would be called your rest inspiratory reserve volume. Then you get the expiratory reserve volume, which is the maximum air you can forcibly breathe out of your mouth, like breathing out, not breathing in. And then your residual volume is like the amount of air that's always in your lungs, like the one that's like in your lungs, right? And of course we got the minute volume, which is the amount, is the way to basically measure ventilation. So you can get that by getting your respiratory rate and multiplying that by the tidal volume. So, and we gotta also uh, know what the normal respiratory rate for adults, children, infants, etc. So for an adult, it's generally like 10, 12 to 20 breaths around that range. And as you're younger, your respiratory rate it's a lot higher. So like children, for example, have 10, 12 to 40 breaths per minute, while infants have 30 to even 60 breaths per minute. It's a bit crazy. Now we're going to talk about the circulatory system. So that's everything to do with your heart, arteries, veins, and it's also very heavily connected to your lungs, also known as the pulmonary capillaries. So it's a bit complicated how the blood goes. So your veins are sometimes drawn in textbooks and stuff as blue. So right here we have the circulatory system. So like this for example. So there's like 2 main veins that kind of go to the heart. Got the superior vena cava and the inferior vena cava, right? It goes through your right atrium, and then there's like a little, should be like a little valve. Yeah, your tricuspid valve. Then it goes over to your right ventricle. Then it goes into your pulmonary artery, where it goes and collects oxygen from your lungs. Then it goes back through the pulmonary vein, and then it goes through the left atrium to the left ventricle, then it goes through the aortic valve into aorta. Aorta is also the largest artery in the body, and it basically sends blood everywhere, right? So the blood is pretty complicated what blood actually is. So blood is like around 92% of water, or no, my bad, 99% water, and everything else is like random stuff basically. And the water is like 92% plasma. So there's a lot of diseases and stuff connected to the heart. For example, you can get a heart attack. It's because the heart is also a muscle. The heart needs blood as well. Even though the main function of the heart is to send oxygen and blood around your body. So there are veins and arteries on the heart. If those were to get blocked by a thrombus, for example, or like an embolism, it can cause a heart attack. And you have something else called myocardial infarction, aka a heart attack. Got that instead. Okay, next we got the what else we got here? Let me see. Nervous system, right? Nervous system. You got your central nervous system and your peripheral nervous system. So central nervous system is everything to do with your brain. You got multiple parts of that. You got your cerebrum, cerebellum, your brainstem. Got all of that together, and then your brainstem has multiple functions to them. You got your midbrain, the pons, the medulla oblongata, and your brain has this other thing called gray matter, right? Gray matter is all this other stuff that's inside of it, right? So yeah, okay. So central nervous system, you got your peripheral nervous system. Peripheral nervous system is like everything else, like the nerves and stuff, right? So it's a lot more complicated. I'm not gonna go too deep into it, but then we have the integumentary system, which is your skin basically, right? Everything to do with your skin. Your skin is like considered the largest organ in the body. Though a lot of people don't really see it as an organ until you learn that. So top part is the epidermis, then you got your dermis, then you got your subcutaneous tissue, right? And then we got the digestive system, right? A lot of this is pretty common in the digestive system, right? Starts up in the mouth, and your teeth will grind down the food, and then your saliva will basically break down your food at a chemical level, and then it'll turn into a little ball called bolus, and then swallow it, and then your epiglottis will make sure that doesn't go into the wrong tubes, so you don't accidentally send your food into your lungs, right? And then you got your esophagus. It will have like this muscle contractions that push it down into the stomach, and the stomach has a little stomach acid in it. And there's actually some conditions where the stomach acid can actually rise up and cause burns inside your esophagus. So that's not good at all, right? And then your goes into your small intestine, large intestine will absorb the nutrients, and then it will absorb the water, and then you poop it out, right? So, and sometimes it might not absorb all the water, so that's how you get diarrhea. When you poop out a bunch of water, it's usually because your intestines stuff aren't absorbing all the water. So usually when you look at this, there's like a quadrant system that people use, especially if you're like a medic and you had to tell the nurse where the injury is. So it says like a so square. You got the quadrant. Let me show you guys real quick. Uh, body quadrants. Like this, for example, you got your RUQ, or your right upper quadrant, left upper quadrant, left lower quadrant, and your right lower quadrant, right? And then there's a lot of different uh, functions. Like for example, there's the pancreas, which I didn't talk about. Your appendix. It's so unsure what the appendix actually does. So and a lot of problems can actually come up to it, like appendicitis, which is basically the inflammation of the appendix. So a lot of people will have the appendix removed just for the hell of it, and you can actually get a lot of different diseases from the appendix. So there's not really any downside to having it removed. And what else? Your pancreas. Your pancreas is kind of part of your endocrine system, I would say, and something to do with your your uh, your whole hormones and all the other stuff, right? And then you got your bile ducts. Your liver connects your intestine through the bile ducts, and then there's your gallbladder, which kind of just stores the bile that was produced by the liver. And the liver is this big ass organ up here. And a little fun fact is that the liver can actually regenerate itself if you have a piece of it cut off. So that's kind of cool. And what else we got here? The lymphatic and endocrine system is a little bit more complicated. I'm not going to go too deep into them. So your limbs are like these thin straw-colored fluid that transports materials from all the lymph tissues into the body. So it's kind of like the body's draining system, and it's really, really important for the body's immune system, right? It kind of helps the body fight infectious diseases and other agents. And then we got the endocrine system, which is a system that kind of ties everything together, right? So it helps with all the hormones, and it has like a lot of endocrine glands, right? So hormones can have like a very stimulating or inhibiting effects on the body's organs and the various systems. Like for some endocrine glands consider adrenal, which are on top of the kidneys, which is what causes you to have your fight or flight reaction. You got your ovaries for females, pancreas basically regulates your glucose, right? And it produces insulin, glucagon, to raise or lower your glucose level, which is why you see a lot of patients who need insulin. It's usually because they have not enough sugar or more sugar body, depending if you have diabetes and all that stuff. And then you get your parathyroid, which is just in your neck. It's like a little, it's like butterfly shape, I'll say. And then you got your pituitary gland, which is in the base of your skull, right in your head. Helps with basically it's like kind of like a mother base for the glands. It controls the other endocrine glands. You got the testes, which in your males basically produces testosterone, and for females, ovaries it's estrogen instead. So you got your thyroid, it's in your neck, and it basically helps regulate your metabolism. All right, and you've got the almost through the end. Got the urinary and the reproductive systems left. So it's both different for male and female, of course. So males, of course, have a penis, and a woman has, of course, their urethra. That's where their urine comes out of. Yeah. So how it works, it comes from the kidneys, and it is the ureter, and the bladder stores the urine, and it goes through uh, past the prostate gland into the penis, and the prostate gland is a huge thing for males because it can cause them to get cancer later on. So when you get to a certain age, you need to do a prostate exam. Your doctor basically, puts on his gloves and then feels your linings for any like abnormalities. And this it kind of gets pushed through with peristalsis, which is also what happens with your esophagus, right? All right, next we have the reproductive system. So males, it's a lot more complicated than the female ones. So these males have sperm, while females have, of course, the ovaries, aka the eggs, right? So I'm not gonna go too deep into that. It's a little bit more complicated. We're just gonna go with the very basics of human anatomy and what kinds we're studying through. And of course, you gotta know your medical terminology as well. So I'll kind of just go over what I learned. Next time was that. So we're kind of going through classes that started. It's going great, and been using other stuff like Anki, which is really great. Khan Academy will eventually go through that once we finish this quarter and start diving deep into our finishing our bachelor's for biology. So a lot of words, a lot of things you just gotta know right off the bat. So yeah, so that's it for this episode for Road to Medical School. So we kind of got a lot of goals. I want to get my GPA to at least a 35, 3.5 before I transfer to a university. Finish my EMT, and I need at least 500 hours of that. Get my bachelor's, 510 MCAT, And like I said, also I'm also an officer in the army, and so you can do that through Army has a great system called AMED Scholarship, where basically they will pay for your medical school, right? But there's a lot of things you gotta do it right. So it's great. You'll pay your tuition for up to 4 years. You'll fund your books, equipment, other school fees, blah blah. And you got a month limit of 2.7K, so they'll pay for your stuff. But you do have to put in your end of the deal. You gotta serve as an officer in the United States Army for a certain amount of years, depending on your contract. You can go into medical, dentistry, veterinary, nursing. See over here. But yeah, that's kind of like the plan. And taking a criminal justice class because I wasn't really sure what to fit in at the moment because I want to take all my biology classes like in the same time period, not like all spread out. But then you got anthropology. It's nothing really to do with biology, but it kind of fits for it. And then you got some important stuff. Uh, Gotta pay my friend back $46. But eventually you have some other stuff I gotta remember. Yeah, my class schedule. Not really sure what to do for Saturday and Sunday for now, but yeah, you'll see. Anyways, alright, that's kind of the update for this episode, and see you guys in the next one. Peace.